Good morning, students. Today's topic tetanus, an acute bacterial disease characterized by painful spasm and stiffness of muscles distributed in the soil, dust, and feces animals and human. Causative एजेंट क्लास्ट्रोडियम टेटेनी के द्वारा ये होता है. Tetanus is an acute, often fatal disease caused by exotoxin produced by Clostridium tetani. It is characterized by generalized rigidity and closing span of skeletal vessels. The muscle stiffness usually involves the jaw, lockjaw, and neck, and then becomes generalized. Minimal inflammation and even unnoticed wound of the most of the cases. Clostridium tetani. C. tetani is a slender, gram-positive anaerobic rod and may be developed terminal spore giving a drumstick appearance. The vegetative organism is sensitive to heat and cannot survive the presence of oxygen. The spores, of contrast, are very resistant to heat, usually antiseptic, surviving autoclaving at 121 degrees centigrade for 10 to 15 minutes. The spores are also relatively resistant of phenol and other chemical agents. The spores are widely distributed in soil and the intestine and feces of horse, sheep, cattle, dogs, cats, rats, guinea pigs, and chickens. The spores also present in human skin agriculture areas. Clostridium tetani toxins. Important toxins tetanolysine and tetanospasmin are produced by vegetative organism. The function of tetanolysine is now also certainly. Tetanospasmin is a neurotoxin and caused by clinical manifestation of tetanus. On the basis of weight, tetanospasmin is one of the most potent toxin now. The human lethal dose in 2.5 monogram per kilogram body, 2.5 kg. Mode of transmission. Contamination of the wound of the spores present in soil, dust, car accidents. In wars and puncture wound, example gunshot. Post-operative tetanus occurs due to infertility still at cataract. Contamination of uterine wound after labor abortion. Contamination of umbilical cord stem in the newly born. Tetanus neonatum. Pathogenesis. C. tetani usually enters body through the wound. In the presence of aerobic conditions in the spores germinate and produce toxin. Toxin disinfectant via blood and lymphatics. Toxin act on CNS sites including peripheral motor of phalanx, spinal cord and brain and sympathetic nervous system. The toxin interferes with the release inhibited neurotransmitter leading to muscles contractions on spasm. Clinical picture. Incubation period of the sponge 3 to 21 days, average 8 days, depending upon the sit from CNS. The shorter incubation period, the higher the chance of death. The neonatal tetanus symptom usually appear 4 to 14 days after birth, averaging 7 days. Tetanus may be local, affecting the muscles of site if infected, rare, less fatality, cephalic, following the otitis media and affecting the cranial nerves. Generalized tetanus, the most common 80% start trigeminal locked jaw, then neck stiffness, difficulty swallowing, then abdominal rigidity. There are also fever, sweating, hypertension. The neonatal tetanus generalized from the non-immunized motor via the umbilical cord, stem and developing countries. Tetanus in severest form. Tetanus neonatum, child tetanus. Complication: breathing difficulty, spinal and long bone fractures, nosocomial infection due to long hospitalization. Laboratory diagnosis: there are the laboratory finding characteristics of tetanus. The diagnosis is entirely clinical and does not depend on bacteriological confirmed. Tetany is recovered from the wound. Only 30% cases can be isolated from the patient who do not have tetanus. Laboratory identification of the organism depend most importantly of the demonstrated toxin production of mice. In mice, sample wound aspirate pus discharge in found transported lab immediately or aerobic transport system. Diet gram stain, gram positive bacilli with drumstick terminal spores may be seen. Culture on blood agar incubation anaerobically on ribostone cook meat medium fluid anaerobic medium followed by subculture on blood agar incubation anaerobically at 30% C for 48 hours. The organism produces heavy hemolytic colonies due to productions of tetanolism, identification of grand stainless film. VR and animal pathogenicity. Animal pathogenicity toxin detection. When a mouse injection IM with isolated organism from culture. The animal developed spastic paralysis, starting the tail and site of the injection, spreading to all over body, ascending paralysis. Toxin demonstration in vivo in confirmatory. Treatment. Antitoxin drug of choice should be given once of neuralized toxins. Human horse antitoxin be given. Human antitoxin 3000 to 10,000 unit IV. Horse antitoxin 1 lakh unit, half IM and half IV. Penicillin in metronidazole, removal of necrotic debris and from wood. Prophylaxis better than active immunization. Alum prescribed tetanus toxide, given a combination of diphtheria toxin and pertussis vaccines. DPT 3 IM doses and 2 for 6 months as booster dose or recommended every 10 years. Booster dose pregnant women can be given guard against neonatal tetanus. Passive immunization. Tetanus antitoxin wound of the person without previous history vaccination to 250 to 500 units human serum 1,500 units profits. I am given protection for 2 to 4 weeks. Thank you everyone. This topic is complete.